And personal satisfaction is where you're taking care of patients you enjoy, surrounded by a team you love. And so it kind of ties into this idea of categorizing your patients. And not all, the reality is not all patients are the same. They're not all the same. And I'd like to think that all patients have good in them, Naren.
Yeah.
That at some level, all patients have some good in them, but they're not all the same. Um, and it occurred to me that it might be useful to do an episode around this and kind of talk about the different categories. I was first introduced to the concept many, many years ago by Dr. Pankey. And he didn't use the A, B, and C analogy. He called them level 1, 2, 3, and 4. And he had very specific clinical definitions for patients that fit in each one of those categories. And I decided to make it a little bit more simple here and look at 3 broad stroke categories of patients. I want to make a disclaimer statement, first of all, Naren, and that's that as a general kind of rule of thumb, it's a good idea not to be judgmental. Would you agree with that as a perhaps a business concept, a leadership concept, a value system concept? Would you agree with that principle of generally trying to be non-judgmental?
Absolutely. I think where this helps, this idea of A, B, and C is, so you understand as a whole, how many or what percentage of your patients are A, B, and C. But you shouldn't use it to, hey, he's a C, so I'm going to treat him like a C, right, and she's an A, and I'm going to treat him like an A. I think that's not a good idea.
I'd encourage you to treat all patients the way you'd like to be treated.
Right.
But with that said, I think categorization can be useful, in a practice. And it's a little bit of a tightrope walking act. We strive to be non-judgmental.
Right.
Meet patients where they are. That's another Dr. Pankey concept. Meet people where they are. Because sometimes, and many times, I would say, that a patient could come into the office with a very low level of dental IQ and over time develop into a patient with a very high level of dental IQ. So, but I'm categorizing them based on their behaviors, and the behaviors that we've witnessed, in your practice. They're still good people. Let me be clear about that. But I'm categorizing based on their behaviors.